We're going to spend a little bit of time talking about disaster crisis, what makes disaster crisis different than other crisis responses, and also briefly outline an intervention model that can be used by a responding social worker to help in a disaster situation. Of course, as a social worker, you may respond in many different capacities to a disaster, everything from providing logistical support to providing counseling services, as well as to be working with other family members or people who were not directly impacted by the crisis but have significant others or loved ones who were. I think it's important before we get started in talking about disaster crisis to just talk a little bit about what defines a disaster, what defines a crisis. And a crisis is an event or a series of events that compromise the ability of an individual or system to function within their environment. And what happens many times in these crises is that the crisis itself generates some stress, and the normal functioning mechanisms that an individual uses, whether it's an individual, whether it's a family or a system, can't manage this stress in the event in a productive manner. And what happens really quickly in disasters is the crisis exhausts both the client or the person who is impacted, but also the helping professional will find themselves really physically and emotionally exhausted quickly. And so when these events occur, one of the things to remember as a social worker is that it's important to pace yourself, understand clearly what your role is, and we'll talk some more about some coping mechanisms later on. But in many crisis situations, we find that the helpers don't necessarily have an understanding of what the most important function that they're going to be providing is. Of course, crisis can be unplanned. It is very chaotic. It impacts many different players on many different levels. The crisis is always left up to an individual interpretation. So in many cases, you'll find individuals who are significantly impacted by one event, where many other people are not by the same event. And that's just because the crisis has an individual impact on each person, and those individuals will have specific reactions. In a crisis and disaster situation, even in the aftermath, the situation can change very rapidly. There are significant human and financial costs, and the crisis will languish or carry on for many months, years, and even decades. One of the things that we know from watching folks respond to crisis is initially after the disaster occurs, there's a very rapid influx of helping resources that are generated to come in and help and support the location and its people who are experiencing the crisis, whether it's a man-made or a natural disaster. However, very quickly, once the crisis is over, those folks who are impacted complain sometimes that the helpers will very quickly become exhausted and move out, and the lingering effects and the disaster carry on long after the initial push for support and resources comes. And so it may be that your best intervention might be to wait until after a month, 2 months, even a year after a crisis, and then go in to provide some support after the initial crisis responders have left the area. So we've talked a little bit about crisis and what crisis is and how it works. I want to spend a little bit of time now talking about specifically disaster crisis. The photograph you see is a picture taken during the ice storm of 2002 here in the Triangle area of North Carolina, Research Triangle area of North Carolina. And if you were present in the Research Triangle Park at that time, that photograph may elicit some emotion from you. And that's one of the key factors about disaster crisis to remember, is that disaster crisis creates lasting, sort of burnt-in memories and reactions for the individuals who experience it. What happens many times in disaster crisis is that when you have a similar event later on, years down the road, that folks who experience the initial event will be impacted not only by your current event, but something that occurred in the future. We've seen that with hurricane survivors. We've seen it with ice storm survivors. In fact, this year in North Carolina, we had several significant winter snowstorms, and many individuals called our crisis services with the intent to get help and support, not really thinking about the current crisis, but using what was burnt in memories from the 2002 ice storm that we had and what their recollections were. So in disaster crisis, individuals are having a difficult time really just meeting their basic needs, both on a physical sense as well as an emotional sense. And so one of the primary functions in responding to disaster crisis is to make sure that folks have their basic needs met. And that means clean food and water, a place to lay their head, and some shelter. The basic Maslow hierarchy of needs have to be met. Just in meeting those needs, sometimes it exhausts the responders. And that is, in fact, a social work response, and that it's not just that as a social worker you do counseling. As a social worker responding to a disaster, you can do many functions and roles that are outside the scope of what we can consider to be traditional social work. When disaster strikes, you have to also remember that those who normally would respond to help in the community are also overwhelmed. And so the responders of the infrastructure in place that would support folks in crisis is probably also experiencing significant crises in themselves, which really necessitates the need to bring folks from the outside to support. And that these deficits and the problems are compounded by just infrastructure problems. And many disasters are both human-made and natural disasters. The infrastructure crashes. And so what we take for granted, whether it be a cable line or an electric line or wireless internet or the gas station pumping gas, those factors again contribute to the trauma and the stress that people experience. One of the other things we know is that your client in crisis is going to have to go through a very predictable series of stages, and what those crisis reactions will manifest both in the client, but also can manifest in the helping professional. I want to outline an intervention model to be used that you could use in responding to crisis that might help support your intervention. I'm going to work off the Roberts 7-stage model for crisis intervention. It's a model created by Albert A. Roberts, and it's a model that I've used throughout my career in crisis responding, and it's proven to be very effective and helpful. Initially, as a responder, you should assess the situation. You assess what impacts there are. You assess what needs exist. You also identify very quickly what are the major problems and situations. Part of being effective in responding is to decide what is, in fact, the most pressing need and what you can accomplish most readily. Very quickly in this process, you want to establish rapport with those who you're going to have the helping relationship with. And it's different than establishing rapport in a clinical sense. It's communicating, talking, asking them what the impacts have been. And most of the time I found that folks very readily engage with a crisis helper who is there to provide support or assistance. Well, before you can really get into the intervention, you have to recognize also that these individuals who are impacted have a lot of emotion. And so allowing them to vent, allowing them to discuss their fears, allowing them to talk about how the situation has impacted them emotionally and mentally is important. And so while it may be imperative to try to get in some infrastructure supports or some basic needs, it's also important to give those individuals impacted room and an opportunity to discuss how it's impacting them. That's also a great assessment tool. One of the things you can do as a responder and a crisis responder is help individuals who have been impacted by crisis look at their alternatives and decide what's most important. One of the things we know that if individuals are impacted by crisis, they're much less likely to be able to problem solve the way they would in normal life. And so sometimes they may have issues or problems that seem very simple dilemmas for us to cure or solve, but may not appear that way to the person impacted. And so you want to help them generate and brainstorm alternative solutions for their problems, and then help them generate an action plan based on the solutions that they generate. It's also important as you generate those solutions and responses that you make sure that they are derived out of natural support systems as close as you can, because if you take a role as providing some support for the disaster crisis that you'll have to continue to fulfill, then you limit your ability to go out and work further in the community with other people. You also want to quickly establish a follow-up plan or agreement that once you identify the issues and the solution and the action plan, that there's a way for the person to check to see whether or not they are fulfilling what they agreed to do to help move themselves through the crisis situation. It seems like this would be a basic action plan that you could implore for someone who's involved in a crisis, but what you'll find is in responding to these things, the things that we seem to think are really simple or that are given aren't necessarily given. There are 4 stages of trauma individuals will experience as they move through a crisis, and it's important for the professional to understand, the social worker to understand, because where you'll find folks, you'd want to be able to categorize that and recognize what you can do to help and support the person. The first stage is shock, where the individual is impacted immediately by the whatever trauma or crisis. Usually in these situations, the person is very much just remote functioning. They may be numb, they may not be able to talk, but in a shock stage, your most important intervention is to get that person safe, in a safe place, and provide some supervision or support for the individual. Once the person comes out of shock, they'll enter a questioning phase where they try to figure out what occurred and what happened. Your job as a social worker in that situation is to help them process their questions, recognizing that there may not be any answers to their questions. A lot of times folks will try to make sense of a crisis or a disaster situation by looking at their behaviors or looking at gods or beliefs or situations that might cause it. I think it's important in that situation to discuss with the client that questioning is normal and natural, but there may not be any answers. And in any case, you do not want to answer the question for the client. Many social workers will try to help the client process this. What you're doing is short-circuiting the crisis reaction in doing that. The third phase is integration, where you help the individual after the crisis integrate what this crisis and experiencing the crisis means to them and how their life becomes better. And so that involves some basic adaptations of reintegrating the person back into what was a functioning sort of lifestyle, a functioning community, and then true recovery, the 4th stage, can occur. One of the biggest problems that I've seen among helping professionals is differentiating between what is crisis intervention and what is brief treatment. And crisis intervention is not brief treatment. And as you can see on the slide, crisis intervention involves some immediate response, solution focused, situation focused. You do it in the field. The major difference between brief treatment and crisis intervention is your goal for crisis intervention is a functioning person. Your goal with brief treatment is going to be a well person. There's very different distinctions between those two, and it's a key distinction to remember. In crisis intervention, you want folks functioning. In brief treatment, you can help get that person to a point where they feel well, if there is such a thing as that. Typically in brief treatment, you're going to use multiple sessions and it has a therapeutic nature involved in it, whereas in crisis intervention, you're going to be looking at a single or very quick pair of goals and working that person through a problem-solving process. There are some key skills to remember when you are working in the field in crisis intervention. The first and foremost is that you must be able to quickly and accurately assess the situation, as well as what the important client needs are, to create sort of a social work triage, so to speak, into what's the most pressing issues for this client. As a clinician, you must be adaptable. You must be able to communicate. You must be able to stay connected and not be judgmental with the people that you're working with. You should also be able to work under severe stress and pressures and maintain focus during all difficult situations. Crisis intervention also requires you to be creative, and creativity can mean anything from ordering intervention to deciding on what sort of problem solution there might be, because in a crisis place, you may not have those natural supports or supports you traditionally would to be able to help a client solve a problem. The key factor in really understanding to be a good crisis intervener in a crisis disaster situation is to have a knowledge of community resources. Now on the slide it says a substantial knowledge of community resources. Many times you'll be a social worker going into a community that you know nothing about to support that community after a disaster. What I'd encourage folks to do is when you get there to ask providers ask other social workers where the resources lie and where the resources are. What you can do in your own community is develop a quick list that you could then hand to folks who come into the community to help respond to disaster, so they also understand where the natural resources are and where the community support resources are in your community. I want to talk very quickly about some triggering incidents. I want to talk about the mental health of a social worker. Of course, we know that there are certain triggering incidents that can have great impact on responders, social workers, and the community, and I've listed those under these triggering incidents. If you have one of these incidents and you are responding to it, recognize that it can have significant impact on you as a social work responder, on the emergency responders, as well as those people in the community. And they can be mass casualty incidents where the media is involved. Typically, when the media becomes involved in covering a disaster or trauma, it exacerbates the impacts on those who are affected and those who respond. I think it's important to understand these things and to make a check mark if you are responding in a situation shows multiple or one of these factors, that you recognize the need to take appropriate measures for self-care for yourself and other responders who are working with you. I want to mention briefly 2 interventions. I'll start with Critical Incident Stress Management, or CISM. CISM is a model intervention that's used to support responders after an incident has occurred. We've used the CISM model in other arenas besides emergency response. We've used it in businesses. We've also used it with community groups on a modified form to help them process and talk about the incident in a way that would be productive and help to contribute to their ongoing mental health. There are many facets of CISM, from a demobilization, diffusing, debriefing, one-on-one sessions. One of the things that's interesting about CISM is when you're working with emergency responders, there are both peer and mental health components. And so it's not just the clinician talking to the group that's affected. There's also a trained peer in the room who can empathize and better understand the situation. Another option as far as self-care is called CMI, or I think it's CMI. The CMI model focuses more on resiliency support than CISM. And you can see from as far as the CMI model, that the CMI model does not focus necessarily on the debriefing and expressing emotion. The CMI model talks about individual sessions, as well as some follow-up. It focuses on a catalog of community resources. I'd encourage you to explore each of these as options to help increase your mental health, as well as protecting the mental health of folks that work with you. We're going to go through a couple of quick slides now that talk about some case studies. Case study 1 is the North Carolina ice storm in 2002, which was mentioned in the past. The issues from the ice storm that you could use for discussion or to think about as you respond are listed on the next slide. I've also listed issues that came up in the aftermath of Hurricane Floyd in September 1999, and those issues are also listed on this slide. As you can see from both the ice storm and the hurricane, the aftermath of the hurricane, environmental hazards and isolation was a major issue for some of the people impacted. I'd like to finish now with 10 clinical lessons that I've learned through crisis responding to disaster and traumatic situations that I think are important for social workers. I call them the 10 clinical lessons. First and foremost, to be an effective responder, you must know your strengths and your limitations. And social worker, you must know thyself. You must also recognize that social work crisis intervention is a discipline, and that not all social workers can be effective in doing this. And if you're going to improve your discipline, you have to train on it and understand it. You have to understand the culture, and culture involves a whole lot more than gender and ethnicity and class. There's culture in communities, and if you're going to be effective in helping those communities, you need to understand the community culture. One of the key questions is to think about as a social worker is, will your involvement favorably change your outcome? If not, don't get involved. Finally, every statement can have its purpose. And so when you go out in the field and you start thinking about interacting with folks who are traumatized, recognize that even the little things you say, if not calculated, can be a problem. I want you to think about what your motivation is to get in this work, why you're involved in it, if it's voyeuristic, if it's If it's for some other reason than helping people, you don't need to be involved. You need to take care of yourself, but the crisis is not about you. You should have reasonable expectations and get your own house in order prior to an incident, both professional and personal. And if you plan to get involved in this, you need to develop the capacities and skills prior to the incident occurring before you respond. That concludes this section about disaster and crisis trauma. I'd be glad to take your questions.